In December 2019, there was a large cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus, or you may know it as Covid-19. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope of proteins covered in spikes. Both the typical influenza virus and the new coronaviruses use their spikes like a key to get inside a cell in your body. There, they take over your internal machinery, repurposing it to build the components of new viruses. Their spikes give them the appearance of a crown, and crown in Latin is called corona. That's exactly how these viruses got their names. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory symptoms range from the common cold to pneumonia, and in most people the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe diseases, leading to possible kidney failure and even death. These include SARS, a coronavirus first identified in China in 2003, MERS, a coronavirus first identified in Saudi Arabia in 2012, and finally, a name we're all too familiar with, COVID-19. Since first occurring in Wuhan animal markets, the disease has quickly spread from sick individuals to friends and family members, along with healthcare staff. So, where did the viruses come from? Well, it's known that the coronaviruses circulate in a range of animals. Sometimes these viruses make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus. For example, MERS came from camels and SARS came from civet cats. So how do we prevent transmission of the virus? We know that its main way of spreading seems to be droplets of infection when people cough. Or if you contact someone who's ill and then touch your face, say rubbing your eyes or nose. In order to lower the infection rate curve, we have to socially engineer our behavior. In an effort to do so, there are a number of standard hygiene practices that have been recommended in order to protect against infection and further spread. These include covering your mouth and nose with a medical mask, tissue, or flexed elbow. Also, avoid close contact with those who are unwell. The appropriate use of masks and personal protective equipment is strongly recommended, especially in the healthcare setting. Washing hands with soap and water, or at least 60% alcohol-based hand rub, is very helpful. It's important to stay home if you're feeling unwell, but if you have a fever, cough, or difficulty breathing, seek medical care early. On a larger level, there are quarantines, which can mean different things, from travel restrictions to actual orders to stay home. Quarantines are a difficult experience, but they create time crucial for researchers working on medication and vaccinations. Thank you for watching. I hope you use what you learned in this video to keep yourself safe and protect those around you. Jacob Getty, rolling out.